One man on an island, one drop in the sea. All it takes to set a wave in motion is a single word in action, a hope that we can be the change that we've been longing to see. For our home, our land, our family, it's all within our reach. See this island, every grain of sand. Hear this anthem, it's the voices of our friends. Come whatever, on the road ahead. We did it before, and we'll do it again.
When the moments turn to hours and the day's last light is gone, look around us always and remember, there were times we were uncertain, but we just kept walking on. It's always darkest just before the dawn. See this island, every grain of sand. Hear this anthem, it's the voices of our friends. Whatever, on the road ahead. We did it before, and we'll do it again.
Our home, the home we share, where the garden always grows to earth and light. Though the road ahead is daunting, I know we're gonna be alright.
See this island, every grain of sand. Hear this anthem, it's the voices of our friends. Come whatever, on the road ahead. We did it before, and we'll do it again.
See this island, every grain of sand. Hear this anthem,
It's the voices of our friends.
come whatever, on the road ahead.
We did it before, and we'll do it again.
Hi, good evening everybody. Welcome now to Geylang-Serai Virtual Community Club, and of course this is our Optimal Aging Talk Show, and we have presenter Doris.
Hello everyone, good afternoon to you. So welcome, and first of all, before the whole thing starts, we would like to do this disclaimer and also to remind everyone that both of us are not medical professionals, we are not doctors. So because everyone, right, have like different sets of underlying conditions, so we advise you to actually consult your doctors or any certified medical professionals for more information and personalized advice.
Yes, definitely. This is our disclaimer.
And then every week, we will want to remind everyone of our 3 simple strategies. So this is optimal aging strategies. Yeah, the first one is exercise. So maybe just a little bit of public service announcement that the new season of the 10,000 Steps Walk is starting, I think in October the 1st. And they are including a new segment called the Sleep Challenge.
Wow.
So not only you have the Walk Challenge, the Eat Healthy Challenge, they will also have a new component called the Sleep Challenge. So looking forward to it. That's also remind everyone that actually sleep is very important. So everyone please have good sleep, about like what, 6 to 8 hours a day, a night,
Yeah.
not a day.
Yeah, day and night lah. Some people, sleep late, so they wake up later part of the day.
Yeah, good sleep lah, more
Good
important than amount. Yeah, too much sleep is no good also. Too little sleep is also no good. Yeah.
So about 6 to 8 hours is adequate for a
Most
good
people,
sleep, right?
most adults, yes.
Okay. And of course, part of the optimal aging strategies, we bring you eating well as well.
Yeah, correct. So maybe we are thinking maybe we should actually share with our viewers whether to show them how to read labels, because nowadays a lot of food that we buy come with food labels.
Yes.
So they actually have different components with like different percentage of these components as well as the different ingredients. So we are thinking whether to share with the audience, if you guys are interested to know more about food labels as well. That is part of the eating proper nutrition diet.
Yeah. Last week we were talking a little bit about this labeling, yeah? So different kinds of packets of chips can contain different variety of...
Yeah, sodium, the calories are different, the sugar level is different, the fats, different type of fats, saturated fats or trans fats. And you remember, trans fats is no good for us.
Yeah. Okay, so part of the optimal aging strategies, we bring you social as well, social network support. Yeah, and this gives you a network system, and as well as a support system.
Yep. So right now over here at our virtual show, we would like to share our social support system as well. Please interact with us. We would love to have two-ways interaction. We also will be sharing more information. Today's topic might be a little bit serious, but as we always say, know our enemies.
Yes, that's right. So Doris will dive right in and share with us about today's topic about knowing your enemies. Yeah.
Last week, our enemies, our body, with time, as we grow, as we age, there will be changes. So last week we spent quite a lot of time, sharing with our audience as well, our viewers and friends about, the different composition in our body as we grow and age. So I will skip this one. I can refer to last week's episode.
Yes.
But in generally, just 3 notes. Water ratio is lower as time goes by. Our muscle tissue ratio is lower. That can result in sarcopenia. And then our fat ratio is also higher. So, that's why, tend to have like belly, pot belly or beer belly.
Yeah.
Yeah. So, okay. So, of course, all this implication, right, of all these changes in our body composition, number one is that when we eat food or medicine is less efficient when our body absorbs.
Yeah, efficiency of metabolizing medication and food. Yeah, this is also about the body composition. And last week, Doris has gone through with us quite a bit about it. You can refer back to last week's episode also. This is body composition and how the body metabolizes, our fat content, our this protein, that means muscle content in the body as well, etc., etc.
Yep. So the second point, we have to remind ourselves as well that we will definitely need to change our diet. What we eat like 10 years ago might not be suitable for us right now, and what is suitable for us right now might not be suitable for us 10 years later in the future. So everyone should have a proper, like maybe the younger kids, they will have to need to more carbohydrates because they run a lot, they do a lot of exercise, PE classes. But when we as we go, as we age, maybe we need more meat and protein or seafood. You never know. Best to check with your dietitian as well. But definitely changes, in diet, we have to take note lah.
Exactly. I remember from last week's body composition chart, as we age, we lose a bit of water content. So you got to drink more, hydrate yourself.
Right.
And
so
also,
that's the absorption of nutrients.
Absorption of nutrients.
They will be affected, so it won't absorb so well. Then our input, right, the food we eat definitely have to be good and healthy so that our body can absorb them, in better amounts. Yeah, the rate will be affected lah.
Yeah, and that's where the exercise comes in also.
Yeah. So maybe generally we will quickly go through what are conditions. Conditions are like diseases or illness. So it's basically divided into 2 parts. The first one is what we call chronic condition. So chronic, right, is things like is long term. So some people say that, I have chronic backache. That means always backache. I have chronic headache. Every few weeks, right? Like more than 3 months,
Migraine,
migraine tend to be permanent, and somehow there will be a residual disability that you have to manage your condition. So some of the serious one may be diabetes, a long-term condition, chronic condition as well, high blood pressure, things like that. Then of course we have other sets of condition. We call them acute condition, which is rapid onset but can be very severe. So for me, right, previously I have this condition where my gallstone got stuck inside the bile duct. So that one is an acute condition because it suddenly happened, and I went to the hospital and it was solved in a very short time. So now I'm better already. Yeah, no further residue
It was-
care taken. Yes. So of course I was very weak at that time. You know, although it's a acute condition, right? I was more weak than rather compared to when it's a chronic condition. Then of course it required more care. I was actually at the hospital for like 5 days.
Oh, I
Yeah,
see.
cannot really walk or jump around lah. Yeah, mostly just lying there, you know.
Oh,
So
dear.
that's an example of acute condition. And one example of acute condition is maybe a flu as well. Yeah, so we are talking about like maybe common flu, not so much of the COVID. COVID one, we are not going to talk about it. We're not going to talk about COVID-19 today, but we are talking about common flu. It is sometimes referred to as acute condition because you get it, it's very, you feel very weak, it's very severe, but after a while you get over it, you recover, your immune system gets stronger, then you won't get the flu that easily. It's, you know, you stop, you recovered kind of thing. Yeah, so there's a difference between chronic condition and acute condition.
I see.
Okay, and now we have this, which is the principal causes of death in Singapore. This
So-
is provided by Ministry of Health.
And this is where Doris was saying, know your enemies. So we present this to you so that you can take care and take precaution.
Yes. Okay, so maybe we can see generally from 2012, this is data we get from Ministry of Health website. You can actually look for it and see whether there's any updated version yet. So far, I don't think so. This is until 2019. You can see one of the percentage principal cause of death, right, in Singapore is actually cancer. So there are like very different type of cancer, which if we have time, we can go through as well. That's why it's very important to kick bad habits like bad nutrition. Smoking and drinking is also, might be causes of for cancer as well. That's why we always encourage people not to smoke or, quit smoking. And drinking as well. Good diet, because diet-wise, they have what we call antioxidants, which
antioxidants.
is actually fight against cancer. Cancer causing. So some food, right, we say, very nice, like a bit chao ta, but actually they contain some cancer causing content as well. Yeah, that's why we always say don't eat food which is like really chao ta, burned,
There's always this warning, like you were fried, then the pan, become chao ta. Try not to consume the food. It's like
I
that,
know
huh?
burnt cheesecake is like a trend now, right?
Yes.
Eat in moderation. We always say eat in moderation. Yeah, you can't eat burnt cheesecake every day because there are still certain components that cause cancer when the chao ta part. You can eat, of course, in moderation, not too chao ta. Too chao ta also not nice, right?
Yeah.
Burnt cheesecake, you have to scrape off the chao ta part just a little bit, just for the flavor and experience. I'll say go for it. Yeah, we're not trying to restrict anyone from enjoying life here.
Yeah, so everything in moderation, yeah? In
Yeah.
moderation. Well, that's something to learn about, yeah? So number one cause of death, cancer. So we got to take precaution,
Yeah.
try to refrain from cancer causing foods and substances.
So we will have other slides later
Yes.
to talk more about the different kind of cancer.
Okay.
Yeah. And number
so
two?
number two, of course, we have up to 10. Number two is pneumonia. Wow, this is something that we learned today. So number two cause of death is pneumonia. Pneumonia do with the lungs, water in the lungs. And it's also actually connected to the heart. That's why we come down next to the third one. But a little bit more about pneumonia is lung function. Yeah, the lung function. It pumps from the heart, the right valve and the left valve.
We will also go through all the cause. We will just go through the list.
Sure.
Yeah.
Okay, so that's where the third causes, number of death, total number of death is heart diseases. And the fourth one, this is cerebral vascular diseases, which includes stroke as well. So 3 and 4 also due to heart diseases. They are very much connected to the lungs, the heart and the lungs very much connected. So we come to the fifth cause of death, highest number cause of death. The fifth
It's
one.
external causes.
External
So
causes.
maybe today we won't talk about the external causes lah.
Okay,
Yeah.
external causes of morbidity and mortality. So so we'll talk about that the next time, yeah. And the sixth one is
What
kidney
about renal?
functions.
Yeah, kidney function, kidney related.
Nephritis, nephrotic syndrome, and nephrosis. Yeah, these are all kidney functions. Yes. Okay, so number 7, we have hypertension diseases, including hypertensive.
Yeah, this is more about our blood and our heart.
Yes. blood and heart.
The
So
heart pressure, blood pressure. It's like, you make me angry, you give me high blood pressure. Stress is one of the leading causes as well.
is this what they call one of the three?
三高,
San
three
Gao.
high, yeah.
Three
That's why
high.
you have to take care of these three, like, which generally we all know three are your blood pressure, your cholesterol, and your sugar level.
Okay.
Yeah.
Yes. So the eighth cause of death is urinary tract infection.
Yeah.
Oh wow. Okay. So this is something that should be able to be prevented. Yeah.
Yeah.
With proper care. Okay. The ninth is other heart diseases. What kind of other heart diseases?
There's many different types, but we will talk about it, of course, later.
Sure.
These are the more so-called not so principal cause lah. Yeah.
Okay, and the 10th is chronic obstructive lung disease. So it goes back to like number 2, pneumonia.
Yeah, but it's different.
Different
It's
ki-
a different condition, although it's related to the lungs.
Ah.
So maybe I just want to share. We are introducing this list to you, not to frighten anyone. It may look very scary. It's just like we keep telling ourselves, know your enemies, because a lot of these conditions can be prevented. And prevention, we are trying to help everyone to find out that it's not scary. Things that be preventive that we can do is like eat healthy, do exercises. It does help, definitely. That is why people is encouraging all these so-called good habits, like good eating habits. Eat properly, don't eat like unhealthy stuff. Exercise the correct way, do enough exercise, proper social network as well. All this, can help to prevent these illnesses if possible. If you have it, then we try to maintain it also. Don't let it get worse.
That's right. Maintenance is also one of the key words.
Yeah.
So don't let it get worse. Maybe you can reverse as well. Recover and reverse, and then maintain.
You realize diabetes not inside?
Yes.
Diabetes usually is not the cause of death, because diabetes will lead to other illness that cause the death. So these are the conditions that actually cause the death in Singapore.
Okay.
Yeah, so diabetes is very common, right? Let's talk about diabetes type 1. Okay, so generally, right, I'm sure a lot of us have known people with this condition. It's a chronic condition, type 1 and type 2. So usually we will talk about type 2 because type 1 is somehow related, something we cannot control. But type 2 is more like lifestyle things that we can prevent by changing our lifestyle. So, okay, of course, scientifically, right, diabetes is caused by, our pancreas is not producing enough insulin.
Yes.
So somehow, you have a high level of glucose in our blood and the urine. Then we never control this blood level, right? It just shoot up, right? We let it shoot up. Then it will lead to other diseases, which will lead to the cause of death. So diabetes itself do not cause death. If your condition or this condition, right, of diabetes is not at the end of the world. If it still can be, maintained, you manage properly, it will not lead to more things. So I think in our previous episodes, we will say that, if you have one condition, like, example, diabetes or renal condition or high blood pressure, you got to see a doctor, you got to seek proper treatment, maintain your condition so that it don't lead to more serious condition or other condition, because everything in us is all interrelated. It's all linked. Yeah. So that's why, we want to remind everyone that, we have to properly control our blood glucose level.
Yeah.
And
because otherwise this can lead to other diseases like high blood pressure, blindness, stroke, kidney diseases, which some of these can lead to death.
Yes.
Actually.
So right now, this is to encourage everyone to take preventive measures by, so-called looking and reviewing our own lifestyles.
Yes.
So we look at our own lifestyle, see that, we can do preventive measure, how to make our lifestyle better, because this one can be changed by, just changing our lifestyles, that's all. That's why we always say, eat brown rice instead of white rice.
Yes.
Yeah, so because white rice will, spike our sugar level because of the high GI. So you eat like brown rice or, wholemeal bread, things like that. Food with low GI, generally, it will not cause our sugar level to go haywire and spike. Then, it will affect our insulin. So that is why, it's related to diabetes. So now we're telling you why we nag and nag. To prevent diabetes or at least to maintain. Yeah.
Yes. the best to
Okay,
prevent.
our next so-called enemy that we should realize is hypertension.
Oh.
高血压, high blood pressure. Yeah, I know when I was young, my mom was like, yeah, you make me angry, very stressed, you give me high blood pressure. Yes, there is fact in it. Stress does cause high blood pressure, but stress, there's good stress and bad stress. So good stress, of course, motivate us, encourage us. Bad stress is those that you know you cannot handle already. So everyone, just take note, there are good stress and bad stress. Yeah, if you find yourself cannot cope anymore, you're under tremendous stress and pressure, please seek help. Talk to someone, a counselor, or someone in HR. To prevent worse lah. Just because stress, right? There are good stress, bad stress. You encourage bad stress, right? It might lead to condition like this, then it might get worse. We don't want it to get worse. Cut off the so-called.
So can this be under like what you say, tame and wicked?
That one is another issue. Okay, we were just sharing with Eileen that there are a lot of problems. Everyone has problems. I also have problems. You also have problems. Everyone has problems. It's just a matter of that problem is a tame problem or a wicked problem. So I'll spend some time here.
Sure.
Tame problem is things that you can solve easily. For example, hey, I'm feeling hungry. So, this is a tame problem. So the solution is, I can just order food or get food, just eat. Wicked problem is something more serious, like things like, the economy, COVID-19, racism. There's a lot of problems that is too big for us and we can't really do anything about it, and there's no short-term instant solution to it. That is called a wicked problem. So all ourselves, our viewers, right, we know that every one of us have problems. So we have to identify that whether this is a tame problem or this is a wicked problem. Because wicked problem, we can't really do anything about it. Yeah, like for example, okay, I'm having a beer belly. I feel that my tummy getting bigger. BMI shooting up. Not so healthy anymore. Do you think this is a tame problem or this is a wicked problem?
I don't know. It sounds both tame and wicked.
It's actually, to me, I feel that it's a tame problem because I can actually take action.
Okay.
Yeah, and I can actually, there is a solution out there that can be solved easily. I can just exercise, regularly, eat healthy. And then it is solvable. Yeah. So this is
and
just,
it's a good thing. Someone leads you to healthy living,
yeah.
right?
So problems can be helpful actually.
Okay. So example of tame and wicked problems. Yeah. But then back to this topic here, we have is the high blood pressure, hypertension.
Yeah, this is something medical that everyone will go to a clinic, right, or a medical examination.
Yes.
You'll put your hand inside a machine, then they will take your blood pressure. I remember when we were younger, some of us when we were younger, there will be the doctor doing the pump. So cute, right? So this basically what they want to do is to find out our systolic and our diastolic pressure. There's just two types. So there's always a range to find out whether you are hypertensive or not so when you are normal. There's like high blood pressure, low blood pressure.
Wow, so classification, like you say, systolic and then diastolic. So Singapore guidelines lah. I guess also very much international, right? Yeah. So normal is what, greater than 130, or smaller than 130 for systolic.
Yeah. So if you are like more than 140, right, means you are hypertensive already.
Oh, I see. So there is pre-hypertensive and there's also hypertensive. So there's a warning lah, so that you can take action then,
Take preventive action already. There are many causes of high blood pressure. Just now we mentioned one of it is stress, overthinking. We stress ourselves. That's why we come and talk about tame problem and wicked problem. Talk to your doctor. See what can be changed, your lifestyle may be changed, or if it's too serious, then they have to prescribe medication already.
Okay.
Yeah, but of course, blood pressure is always one of the gateway to find out overall health.
I didn't know that. Blood pressure.
That's why every time you go to see a doctor, right, at the clinic for the very first time, they will take your height, your weight, and your blood pressure. Yeah.
True.
So because this is like the gateway, the first sight. And maybe I'll just talk a little bit about white coat syndrome. White coat. I think white coat.
Oh, yes.
Okay, there's this white coat syndrome that they say that when someone, they are taking the blood pressure, right? The blood pressure is slightly very high because they feel nervous because of the staff or the nurse or the
Environment.
doctors wearing the white coat. Yeah, so that's why we call it the white coat, because they feel nervous, so their blood pressure starts going up. Yeah, so everyone just relax, it's nothing, it's very normal. Just go ahead, take your blood pressure. Now it's very easy, they don't need to pump and pump, you just put your hand inside.
Yes,
Yeah,
that's right.
it's very normal and harmless one. They just want to assess and find out what's your blood pressure. Don't be stressed. Yeah.
Okay,
If
don't be
not,
stressed out by the white coat.
they become like misdiagnosed. You normal blood pressure, then because you're nervous, you see the white coat, you see a lot of doctors walking, then you feel stressed, and the blood pressure result come out.
Oh no.
Not that good.
Okay,
Yeah.
misleading.
So maybe we'll talk a little bit about the complication.
Yes.
If your blood pressure can get high, right, can lead to other conditions as well. So the other condition, CVA, right, is our stroke. Yeah, which can get fatal.
Yes.
And then of our heart failure, kidney failure can get fatal as well. So blood pressure high, you won't die. It's not fatal, but it can lead to other conditions.
Oh,
Yeah.
okay. Well, it leads to stroke as well as kidney failure.
Depending, of course, you wouldn't want to get all, but
Yeah,
this
yeah,
is just prevention. We are
Prevention.
teaching everyone that worst case scenario kind of thing.
Understand.
三高, right?
Sanka, oh wow.
Just now, first one is sugar level, our glucose level, and now shoot, right?
Yes.
That lead to diabetes. The second one is our blood pressure, very stressed, you make me stress, or anyhow eat, Third one,
High cholesterol. Ayo.
Yeah, so I think previous episode, as I mentioned, cholesterol, there are two types. One is the good one is the bad one. Yeah, so LDL is the bad one. Yeah, and then HDL is a good one.
Okay.
So when we talk about cholesterol, right, we like to talk about heart and oils. We will encourage people to eat healthier oil. I mean, of course, oil in moderation. There are many different types of oils, right? So trans fats is the worst kind of oil. And then to me, I feel that monounsaturated fats is the best kind of oil. Monounsaturated fats can be found in peanut oil, olive oil. Of course, the oil itself have other components lah. Then the good oil is only part of it, but it has the most amount. So that's why we say that if you have to use oil, don't use a lot, of course. But if you have to use in your cooking or flavoring, then use the one that the better fats that cause better HDL lah.
HDL cholesterol.
Right.
oils.
Good. So yeah.
Yeah, so we go with LDL cholesterol. That's low density lipoproteins. We call it LDL. So it's bad cholesterol. So a high LDL level leads to a buildup of cholesterol in the arteries. So very dangerous, Can
It's
clot.
like, for example, when you are young, the dentist will ask you to brush your teeth, right? Because of that plaque. So it's like, you become the cholesterol, it's like plaque, then it become in your artery, then stuck.
Oh.
Yeah, it's like a plaque like that, it's something stuck there.
I see.
Yeah, but it's not teeth, it's, the cholesterol stuck there because it's lower, so it will get stuck. But for HDL,
Okay, HDL cholesterol, high density lipoproteins, that's HDL. So these are good cholesterol. And it helps to carry cholesterol from other parts of your body back to the liver. No wonder you said high blood pressure, got problems with liver, kidney and all. So with the good cholesterol, it actually carries this good cholesterol back to the liver. The liver detoxes.
Because the low one gonna stuck in the arteries, right?
Yes.
The high one is lighter, like high density, right? That means it can move. Yeah, it don't gonna stuck. Yeah, but this is too medical or technical already lah. We just want to remind everyone, just take note that LDL, HDL, two types of cholesterol. Let's go for the good cholesterol. Help us. Yeah.
Okay, liver
So that is
metabolizes
related
as
to
well.
food also. And exercise. Exercise will help us to build up our good cholesterol and get rid of the LDL.
Detoxification, the oxygen flows through our blood system. Okay, narrowing of the blood vessels could be attributed to atherosclerosis, where plaque fats build up in the walls of the blood vessels.
So this is just now the one that I said is something similar to the plaque built in our teeth. This one is because the plaque, right, is built on the wall of the blood vessel already.
Narrowing of the blood vessels.
So because the blood vessels is like maybe like this size, okay, can see So because of the plaque built up, right, so less and less able to flow in already. Yeah. So that's why become dangerous and become a condition already.
I see.
So you see, it's still already at blood pressure increase, you very angry or you know,
Angry?
your
Is that why people high blood pressure
then
very
so your
angry?
blood pressure increase, then you're gonna block. So if your blood vessels to the heart, right, block. Okay, just now we were saying that the blood flow will be more, how do I say that, narrower.
Yes, yes.
Yeah. So once it block, become heart attack.
Ah.
So if there's a blood vessel in the brain, right, same thing, gonna block, then become stroke. So actually it's the same condition, it's just that it affects different parts of our body. That's why it use different names. Yeah. So remember, if it's related to the heart, the blood vessels towards the heart, right, related to the heart, become a heart attack. Then if it's the head, the brain, then it become a stroke. But it's all caused, you know, the similar movements of the blood vessels.
Okay.
Yeah.
So the effects, stiffened arteries, this is where you say BP increases. So
Yeah.
angry, angry.
Not only angry is just an example that we are using. There's also a lot of other factors like food intake, etc., lack of exercises, etc.
Okay.
Yeah.
So we got blockage, blood vessels of the heart. So yeah, as you mentioned, heart attack. So blockage, blood vessels to the brain, and that's stroke.
Yes. Maybe you want to see anyone viewing or any comments or questions so far?
Okay. So far, no comments yet.
Okay, it's okay.
Thank you
Then we
for watching.
continue. Okay, just now our top
Yes.
principal cause of death, cancer. So cancer, we always say is our cells haywire. That means normal already, suddenly, you know. So the cells, it's become like not the normal way of functioning,
Yes.
that they will destroy even the normal body issue.
Oh,
Yeah.
wow.
So there's like different different kind of cancer, right?
Yes.
So it's just to find out that which cells in our body has gone haywire already.
Oh my.
Yeah. So become abnormal. Yes. Okay. So yeah, this is the 10 most common cancers affecting both women and men. 2014 and 2018.
Okay. So
Yeah.
colon and rectum.
That's for men.
For women, it is breast cancer.
That's why we always encourage women
Yeah.
to actually go for breast exams. I think there's a lot of
Mammogram.
subsidies or even what you call that, free.
Yeah, screening, health
free
screening.
Yes, for men and women. I mean, men in colon as well. I think once you reach a certain age, I think Singapore Cancer Society will give you a letter to encourage you to go for screening. Yeah.
I see.
Then, of course, this is all preventive measures because earlier you detect, the faster you'll be able to seek treatment. Then at least you can get it under control. Don't wait until it's too late. Yeah.
Indeed, indeed. Okay, so for men, number 2 is prostate. And for women, it is, colorectal and rectum. So for men, the third is lung, and women, same as well. Third is lung. For men, the fourth is liver. And,
Uterus.
Women's uterus. Oh yeah.
Womb
that's
cancer.
Womb cancer. Got to take care. These are women's parts. Okay, so for men, moving on, next we have lymphoid neoplasma. Okay, so this is lymphatic system.
Yeah.
Oh wow. Okay.
For men,
Yeah, so this is a virus C. And for women, is ovary and fallopian tube.
It's our reproductive
System. Yeah. And next for men is non-melanoma skin. For women is then the lymphoid neoplasma. That's cancer as well. Non-melanoma
a
skin.
kind of cancer.
Kind of cancer. Okay, next for men is stomach. And for women then it's the skin, non-melanoma skin. So moving down, the next for men is kidney, and women is thyroid. Oh yeah, I do come across a lot of women, they have thyroid problem. Yeah. So either overactive or underactive. Yeah.
The hormones, right?
The hormones, indeed.
Yeah,
hormones.
so we have to take care lah.
Yeah.
Hopefully they don't develop into cancer.
Do they?
I don't know, hopefully not.
Yeah. So far I think is
The treatment will keep it under control, and of course diet and lifestyle also.
Okay. So next for men, it's the myrtoid neoplasma, and for women it's stomach. And the final one for men is pancreas, and women is the cervix. So also women reproductive system. Yeah.
Move on.
Got to take care. Yes.
Yes.
10 most common cancer causing. Oh, respiratory system.
Our lung.
Lungs. Yeah, so here, decrease in vital capacity, decrease lung elasticity. So
Yeah.
something like the throat that Doris has mentioned, you can actually tone your throat muscles. But the lungs, how do we tone then?
Actually, there's lung exercises as well. I remember last time, right, I was taking yoga. So yoga, there's like breathing methods that help you to, increase your lung elasticity as well. Yeah, breathing exercises.
Yes.
Yeah.
Oh yeah, I do remember. It's the rib cage breathing exercises,
There's a
Alexander
lot of
technique.
different types.
Yeah. Then the muscle walls will expand, move, and breathe correctly as well. That means not breathing through the chest. She breathe down into the diaphragm. Yeah. So reduced muscle strength in the chest can cause respiratory system. And then can cause respiratory problems. Sorry. That impaired cough efficiency may be more susceptible to chronic bronchitis and pneumonia. Oh my goodness, so if we cough wrongly or we can't cough properly, and it can cause pneumonia. Like you say, the water go back into the lungs.
Because of dysphagia.
Oh.
That's one of the factors. I mean, there's a lot of different factors. So dysphagia is the part where our older adults or some patients, they can lose the ability to swallow. Yeah, they lose the ability to use the muscle. So then, of course, when you're not careful, you try to drink water or you try to eat, then the food, instead of going to the stomach, you go into the windpipe and straight to the lung. And it becomes dangerous. Then it can lead to chronic conditions which is related.
So maybe kena infection or something.
Yeah.
Oh my goodness. Wow. So one thing really leads to the other. Wow.
So remember, once you find out, that's why we always encourage early screening. Early screening so that we can detect the condition and then maintain it. Yeah, rather than it leading to worse and worse and worse. I mean, basically, I guess medical care in Singapore is still quite, it's a good thing lah, compared to a lot of places.
Yes.
Yep. Okay, hold on. Okay, so pneumonia. Okay, we talk a little bit about pneumonia.
Sure.
This is because it's one of the principal cause of death. So a lot of things, we are trying to see why, it lead to all this lah, and then what we can do to prevent it.
Yeah.
So just Eileen has mentioned, it's actually an infection. So like for example, we drink water wrongly or we swallow, sometimes we have phlegm inside, then it fill up the air sac inside our lung. So that's why, it become a condition. Then if we have other conditions such as heart failure, or lung problem, then it become fatal, can actually cause death.
Wow.
Yeah.
So, yep.
Okay, this is a different one. This is called, COPD, chronic obstructive pulmonary disease. This one means we very, very hard to breathe. So there are some people, they're like, they cannot breathe properly. Yeah, so it's actually, some other indications, like from all this, it will cause, this is a condition. So there are other illnesses that will cause this disease, and it also will damage the air sac inside the lung. So ultimately, a lot of condition you see with lung related is all the damage to the air sacs inside the lungs.
Oh.
Yeah, and we have to take note.
Yeah, I have to take note, yeah. So also due to the muscles as well, right? The muscle wall.
Partially.
Partial,
yeah. We cannot determine. There are so many different factors also. Yeah.
Understand.
But we have to take care. That's why we will say mindful breathing is actually a very good habit to do also. Do regular mindful breathing. And, I think smoking is also
obstructive. Okay, so this is a chronic obstructive pulmonary disease, progressive disease that makes it harder and harder to breathe, like bronchitis, asthma. Indications. These are indications of chronic obstructive pulmonary diseases. Bronchitis is the inflammation of the bronchial tubes, and of course, there's damage of the air sacs in the lungs.
Yeah.
Wow.
Okay, and then we will say that this same disease, right, this condition, the cardiac output is reduced already. Then our blood pressure will rise. Yeah, then it will lead to all the different heart diseases, which is fatal, principal cause of death, remember? Yeah, so this condition, although it's lung related, right, it can also lead to the heart diseases, like stroke or heart diseases. Yeah.
So reduction in muscle bulk, replacement of heart muscle, with fat, replacement of heart muscle with fat, loss of elastic tissue, and increase in collagen Atherosclerosis. The
Kena
plug
stuck.
thingy.
Yeah.
I see. Okay, so this is under COPD as well.
Heart attack.
Heart attack. Okay, my goodness. When there is insufficient blood flow for a prolonged period of time, this damage results in death of heart tissue. So you get chest pain, sweating, breathlessness, and sudden death.
This is like every time we watch drama or TV, right?
Yeah.
Then the character, they have a bad news, then they heart attack.
Yes.
I think it's something quite similar actually. Yeah.
Due to insufficient blood flow. Wow. Okay.
Okay, other heart problems?
Other
Cardiovascular?
Other cardiovascular problems. Heart failure. You get increasing breathlessness. So take note if you see this happening in any individuals. Notice the signs and the symptoms. So increasing breathlessness. Also irregular heartbeat, like palpitations or even fainting. Oh my.
Yeah.
Okay, then there's atrial fibrillation. That is the breathing, the throat breathing, this equipment. Equipment. And then sudden death.
Okay, so I'll continue on that these causes of all this heart failure, right, is like coronary artery diseases such as the previously we were talking about heart attack, high blood pressure, atrial fibrillation, pulmonary heart disease, excess alcohol use.
Oh my, okay.
Infection and cardiomyopathy of an unknown cause.
Oh.
So yeah, it's a lot of condition there to absorb. But
Wow.
actually, excessive alcohol use is one of them.
Can cause heart attack.
Interesting, right?
Interesting. I thought it just makes you go blind, because it's toxic to the liver.
Okay, so next, something related also, stroke. Remember, stroke is like the blood vessels to the brain is affected, right?
Yes.
Yeah, just now we were mentioning there's a clot. Clot, C-L-O-T, clot, kena stuck.
Yeah, clot.
Ayo. So the
Aiyo.
blood vessel, the brain is stopped. So because there's no blood in, right, no oxygen in, right, then the brain cells, they don't function, they die off already. Yeah, so that's where people get stroke lah.
Oh.
Yeah.
Causes brain cells to stop functioning or die. Seriousness of a stroke depends on which part of the brain is affected. Yeah, makes sense. And how big the area is affected. So some people are still lucky.
That's why they say a minor stroke, major stroke.
Ah.
Yeah, so very interesting point. This one I actually see in a lot of polyclinics, and I think a lot of clinics,
Yes.
medical places, they will have this. This is the signs and symptom of stroke that everyone have to take note. If you have loved ones, suddenly, you suspect, just can do this four. These 4 questions. First of one, FAST, they
Yes.
put it simple lah. First one, F. Your face, is it drooping? Do you see like one side of your face is like sengek or like numb already, like no feeling? Yeah, so you got to check the face. Is it like one part sengek, or is it like when the person tries to smile, it's like, how come look funny? And yeah, so this is one of the sign or symptom of stroke. The second one is that is the one of the hand like weak or numb. So you try to ask the person, right? You raise 2 hands, then the other person can raise both hands properly, or it's like, one hand like cannot, then you got to take note. So FA, one is face, one is the arm.
Okay.
The third one is S. S is the speech. Is the person speaking properly, or is the person like is it hard to understand? Is the person unable to speak properly? This is S. Another symptom or sign of stroke. Then T, and please, time to call 995.
Yeah.
Any one of these symptoms, you got to take note already, can be a stroke.
Just any one of these symptoms.
Yes, any one. Remember, F, our face.
Face. A, our arm. S, the speech. So
If any one of these, time to call the ambulance.
Okay.
Need immediate medical
attention.
Yeah.
So no need to be all 3, you notice, or just one in the person you're facing, Yeah. So get the help immediately so that you can save a life.
Yep. Everyone please take note, screenshot.
Screenshot.
Okay, what is not normal aging? So previously we were saying dementia is actually not a disease.
Yes.
It's actually a term that says that there's a lot of different symptoms that is like associated with like you can't really remember or you can't really think that well anymore. Yeah, decline in memory or any other thinking skill like cognitive skills. Yeah, so it's not a disease and it's not normal aging.
Oh.
Okay, so one of it, which is actually
Alzheimer?
quite common, Alzheimer, it somehow your memory, thinking, behavior, or to perform, right, somehow is not that good anymore. Yeah. So that is dementia.
Okay.
Remember, it's not normal, but however, just to note, worldwide, right, around 50 million people have dementia with every new cases, at least 10 million new cases every year.
Oh my goodness.
Yeah. It's not a nature. It's not natural part of aging, but it's happening very often.
Wow.
Yeah.
And it's not a natural part of aging, but it's like, so
I don't know, trending. I can't say it's trending. There must be, you are not alone. Just remind yourself, if your people around you or yourself is having this condition, you are not alone. Although it's not a normal part of aging, right? A lot of people is having this issue as well.
Yeah.
That's why we were saying really salute and applause all the caregivers, around. Thank you for taking care, of the person around you. Just take note. It's very normal.
Yeah, and it's not easy to take care of.
Normal in the sense that it's a lot
common.
dementia cases.
It's common.
Yeah, it's common.
Yeah. With this data, 10 million new cases annually. So it's, we have to take note lah. It seems quite troubling as well, since it happens so frequently. So
imagine the population of Singapore is only like what?
Just Singaporeans will be 3.5. Then with everyone else is about 5.5. Yeah.
This is times 2, times 3 even. Yeah. So we have to take note that it happens lah. Although it's not a normal part of aging or growing, but it just happened. Okay. So it's actually Alzheimer. Just now we were talking about dementia, right? So Alzheimer is the most common form, and it's like 60 to 70% of the case, and it's progressive one. That means initially you wouldn't realize that it's dementia, until that the symptoms get worse and worse. It's a progressive in different stages one.
Oh.
Yeah. Then the other type, that one is the Alzheimer, right?
Yeah.
The other type we call it vascular. So this one is stroke related. So some people, just now we say that some people get stroke, right?
Yes.
Because the blood vessels to the brain, is affected. So some people, after they have stroke, they might experience what we call a vascular dementia, which actually is the second most common type. So this one, the second type is like after the stroke then it happened. Whereas Alzheimer is that it suddenly happened and in a small dosage and then it progressive get worse. So a lot of people when they first get Alzheimer disease, right, they don't know what is it. They thought that maybe the person just forgetful, or the person trying to be funny, or the person attitude problem, but actually it's a disease. Yeah. So we got to be understanding as well, especially to our older adults, that sometimes we just have to be understanding. They're not trying to be funny, or trying to give us attitude. It's just that this is a disease and they can't help it as well. They will also feel frustrated or embarrassed, paiseh, or frustrated lah, that how come these things are happening? How come keep forgetting about this, keep forgetting about that? But they can't help it. Yeah, it's not a natural part of aging.
Oh dear. Okay.
It's a disease.
Understand.
Okay, so the other one is our muscular. This is also not a natural part of aging.
Oh.
Interesting, right?
Loss of bone density in both men and women, osteoporosis, will get loss of height, etc. as well, because the body mass decreases, caused partly by loss of muscle tissue as well. Oh, so musculoskeletal includes the muscle tissues.
Muscle and your bone.
Muscle and bone. So as you grow older, instead of growing taller, get shorter. Okay, yeah, understand. So there's stiffness in joints or wear and tear of joints. This is osteoarthritis. And also decrease in strength and stamina. Oh, stamina comes in as well.
That's why I would say that this is not the natural aging process, right? So, which is why we want to get everyone to do exercise also. Because of strength exercise, your balance exercise, then of course there's a lot of calcium. You can encourage people to take proper intake of calcium because I guess a lot of people don't like milk products, dairy
Yes.
products. Yeah, then doctors will have to prescribe those calcium pills.
Uh,
Yeah, but of course, be careful when you take the calcium pills. The doctors will let you know before, after meal, in the morning or at night, things like that. Please follow instruction because of drug interaction with food also.
oh.
Yeah, so calcium is quite sensitive in that case, calcium pills. We have to take note lah. This is not a natural process of aging, but we can take preventive measures lah, while we
Measures,
can exercise and take your calcium, things like that.
And maintenance.
Yeah. You know, we always say that you don't exercise and you 腰酸背痛. Then you believe that you exercise, you loosen the joints. Then it's not so pain. Then you increase your strength also by doing those strengthening exercises.
Endurance
Yeah.
exercises.
Then your stamina, you run your cardiovascular, it's there.
Yeah. So it's training, yeah?
This
Oh
one.
my, arthritis, rheumatoid
Very scared.
arthritis. Yes.
I also very scared when I see this, but we have to face our enemies.
Yes, face our enemy and know and understand, where it's coming from so that we can take preventive measures or learn how to maintain and pain management.
This is also not a natural part, normal part of aging.
Okay.
Yeah, so this is where your joints, right, the membranes, they all inflammation already. Yeah, so you got all this swelling, pain, 风湿 is it?
风湿, yeah, 疾风 they say. Yeah, characterized by pain, swelling, bone dislocation, deformation.
That's
the
worse.
bone
You're gonna get worse.
Wow, and limited range of movement,
I
definitely.
mean, you can't really move that much. Yeah, last time you were saying that people cannot do all this action, right?
Then unbalanced, one hand cannot raise, due to all this. But bone dislocation can be caused.
If it get worse lah. It's we don't want it to get worse. That's why we will say exercise, so can prevent all this. Yeah.
Also autoimmune disease. Wow. So many problems and issues come out from arthritis and rheumatoid arthritis.
Yeah, this is actually, they say that, you never take care. Like some people will say that when you give birth, you never take care. I don't know how true it is, but ultimately, I believe that talk to the doctors, talk to medical professionals. If you exercise and have a proper diet, you should be fine. I think exercise does matter. The other thing is what they call the carpal tunnel syndrome. That I don't know whether will lead to this. Yeah, but it's actually all affecting our joints. Some people like to use handphone, then become that carpal tunnel disease already. So, give your body a break, but also give them proper exercises rather than just following just one action. Then it will lead to a lot of different conditions. Yeah.
Understand.
Okay, so we continue on.
Arthritis or osteoarthritis as well. This slow deterioration of joints that experience the most stress. For example, it will be your hands, like you say, carpal.
The handphone.
The knees, your hips, and then your shoulders. So this is slow deterioration of the joints.
You won't know it until it gets worse and worse. Actually, the symptoms will come out, but because it's so minor, you didn't realize when it start. Then it gets worse and worse. By the time it's like 腰酸背痛 here, pain there, pain, then you can't. So once you realize that there's something a bit wrong, you got to take action. Like for example, I feel that my shoulders very tight, so I keep going swimming. So hopefully it actually gets better lah. So actually exercise, trying to stretch does help.
So swimming, like you say, stretch, then the blood flow. So hopefully the tissue can repair itself. Then the muscle strength to hold the joints together like that. So caused by wearing down of the protective cartilage at the ends of bones. Oh my goodness. So cartilage.
They say the jelly no more.
Jelly no more. Oh dear. So drink collagen.
Doesn't help.
Collagen
doesn't help, unfortunately. I mean, scientifically speaking, because the collagen, when you ingest, you have to break down. Then after that, your body have to rebuild again. So I don't know what is the percentage, whether collagen help or not. But scientifically, they say there's no direct link lah. It's not a direct process. You have to break down first, then you have to build up. Yeah.
Wow. Okay. So symptoms include pain, tenderness,
stiffness, loss of flexibility, etc. Yeah, so loss of flexibility is like what we say, the range of movement is restricted. You cannot move as properly, you like try to stretch a bit, then you pain, cannot move, restricted range of motion. Then of course the tenderness you touch,
Oh, the
then you
tendons
stiff also.
Oh my goodness.
Very stiff, 腰酸背痛 basically.
Yeah.
Then at normal alignment already.
Oh,
so
dear.
because of long, like you pain, right? Like for example, my knee pain. Then I try to walk.
One side compensate.
Yeah, compensate. Then become in long run at normal already. At normal alignment, like the car. At normal alignment, So different parts of body as well. So remember, this is not a natural part of aging or growing. This is something that either we never take care or we do something weird to ourselves, then we lead to this.
Oh dear. Okay. So don't overstress the joints. Yeah.
Do proper exercise and proper diet. Hopefully it will
Proper
help.
diet. Yeah, I believe also a proper diet because sometimes over alcohol excess, smoking.
Over here already.
Okay, the management. Thank you. Arthritis, osteoarthritis management. Reduce weight so you don't stress the joints so much.
Especially your kneecaps. They say your kneecap pain, right? Actually, loss of weight might help also. Especially with your BMI. You check with your doctor, your BMI a bit higher, right? You don't say, a bit high. But it will cause the knee to be painful because it happened to me also. I was actually overweight.
Oh.
Yeah, so I try to reduce weight and now the pain on the knees is not so bad already. Yeah.
Okay. So it says also to exercise so you can strengthen the muscles. Yes.
Like the swimming, my shoulder pain. I think maybe because I like to hunch and use the laptop or the handphone. Then after that, my back and my shoulder become very pain. So I try to exercise the area, which the best way is doing breaststroke swimming lah. Yeah, and swimming is good exercise because it's low impact, as in it doesn't put any strain on the body. Yeah.
Yeah, because the water floats, no gravity. Okay, minimize pressure on your joint cartilage.
Yeah, which actually one of the factors is your weight. That means you got to support excess weight.
Yes.
Yeah, then you put the pressure already.
Okay. Swimming also, you minimize the pressure because you're floating.
You're not like running and then kicking up.
So choose a form of exercise that doesn't stress and put pressure on the joint cartilage. So you can take medications for pain or supplements, glucosamine.
I don't know how effective it is. Check with your doctor, but there's some pain relief also lah.
I see.
Then
MSN.
of course the worst. I mean not say the worst. If the knees is really, the doctor say you cannot take the pain anymore. You will have to go for total knee replacement, and then you have to go for therapy lah. Yeah. That one is one of the measures that we have to do. If not, we can't walk properly.
I see. Total knee replacement. Osteoporosis, dramatic loss in bone mass, increased brittleness of bones, and this may lead to height loss, back pain, a stoop posture, and increased risk of fractures. Oh my goodness, fractures.
Maybe I'll talk a little bit about this. We are saying that the bones, right? There's a lot of ways. Then some is like maybe you take calcium or like, remember all these conditions is not a natural part of aging. So the thing is that they will say that woman is always more affected. The thing, menopause, when women go through menopause, right, we are affected quite badly by this. Usually before menopause, right, it's the men who will be affected by this condition. Yeah, so when women menopause, then there'll be a lot of changes in our body, especially with our hormones as well. So this is actually one of the factors that we have to take note, that our bone mass suddenly, you thought you lose weight, but actually it's your bone lose weight. That's why your weighing machine look like lower, not because you lose your fats, but maybe you lose your bones.
I see.
Okay, so do we have time? We still have time to maybe go
3 more minutes.
Falls and fracture.
Okay, so older adults who fracture their hips have a mortality rate of 20 to 30%. Within 1 year of the but why? It's just a fracture. It can heal.
Not really, because they are like older. Then 20 to 30% is because they lead to other different conditions. They can't really move a lot.
Oh,
Yeah.
Then bed rest.
Then you look to more and more. That's why I say exercise is actually a very important thing. Then with social support, then when you can't really move, right, you fracture already. There's a lot of different factors. So two of the main factors that I believe is that number one, you don't exercise, then your conditions start to deteriorate. Number two, you don't have such a strong support network anymore, social support anymore. Yeah, it's like you can of course eat as usual lah, but maybe you want to go toilet also a problem. Then you start don't want to eat it.
Oh dear.
Yeah.
I see. Okay, so the majority of older adults who had fall related fractures have not recovered their pre-fall functional level 1 year later. Oh my.
So best don't fall.
Yeah, don't fall.
Yep. Okay. Yeah, this one I think quite important also.
Okay, you can finish it up.
Yep, the
then for
common
us.
risk factor for falls, right? Number one, we can't really control our balance. Like for example, we have like, as we grow older, sometimes we have different condition. Then the worst thing is that we have to take medication. So when we take a different type of medication, especially 4 or more, right? Then our blood pressure will drop, and then it will affect our balance. Yeah, then of course the gait, the walk different already, arthritis, cognitive impairment, we can't really think so well, increased age, visual impairment, we talked about it before, we can't see properly, then we tend to fall down. Then of course the use of drugs, will affect, then the sarcopenia, we talked the muscle mass loss already,
Yes.
no
Atrophy.
so much muscle already, so we don't move. Yeah, then of course the home, we say declutter. Yeah. Okay, so that's the last slide for 4 then. Yeah, just take note that these are the common risk factors.
I see. Wow. Thank you so much, Doris, for sharing with us all about this. Maybe we can let everyone know again, this is about knowing your enemies.
Yeah, this is about knowing your enemies. So we come up with a lot of conditions. Some you might have heard of, some you might not have heard of, but just take note. What are the ones which is so-called not normal part of aging, and we can change our lifestyle, take preventive measures also.
Okay, so we hope that you have learned something from our talk today, and of course share it with your family, loved ones, and those around you, and take note and keep an eye out for your family, loved ones, and everyone around you. If you notice any symptom, take proper measures, and of course preventive, help them in preventive measures, maintenance, or if you need to call the ambulance, then do so. Yeah, okay, with that, we've come to the end of the program for today. Hope you enjoyed yourself. We'll see you again.
Thank you.
Thank you. Thank you, Doris.
Thank you, Eileen. Thank you, everyone.
Thank you, everyone.